For effective leadership, so leadership is a learned process, okay? So in order to become an effective leader, so you must undergo a process and it should be learned, okay? So that is your effective leadership. I have here characteristics of effective leaders. So effective leaders use leadership style that is natural to them. They use leadership style appropriate to the task and the members. Assess the effects of their behavior on others and the effects of others' behavior on themselves. Are sensitive to forces acting for and against change. Express an optimistic view about human nature. They are energetic, are open, encourage openness so that real issues are confronted. Facilitate personal relationships, plan and organize activities of the group. Okay? They are consistent in behavior toward group members. Delegate tasks and responsibilities to develop members' abilities, not merely to get tasks performed. They involve members in all decisions. They value and use group members' contributions and encourage creativity. They also encourage feedback about their leadership style and assess for and promote use of current technologies. So these are the characteristics of your effective leadership or leaders. So we also have principles of effective leadership. So we have vision, influence, and role model. Okay. So for the vision, a mental image of a possible and desirable future state. Okay. So as an effective leader, you should be visionary. Okay. You have a plan for the future. So that is one of the characteristics in order to become an effective leader. We also have influence. Okay. An effective leader should be an influencer. Okay. It is an informal strategy used to gain the cooperation of others without exercising formal authority. So exercise through persuasion and excellent communication skills. Okay. So in order to become an effective leader, you must be a good communicator. Okay. You should know how to persuade your members or your employees, your workers, in order to cooperate in a particular organization. You need also to be a role model. Okay. So someone who sets the example for others to follow. Okay. So as an effective leader, you must also you must be a role model to them. So we have here management. So what is management? It is the art of getting things done through and with the people in formally organized groups. Okay. It is an art of creating an environment in which people can perform and individuals can cooperate towards the attainment of group goals. Okay. So this is an example. This is a good definition of your management in a general sense. Okay. However, when we say nursing management, so management applied in nursing, so it consists of the performance of the leadership functions of governance and decision making within the organizations employing nurses. So includes processes common to all management like planning, organizing, staffing, directing, and controlling. So that is your nursing management. It's management applied in nursing. So we have here chain of command. So the reporting relationship among staff and managers. Okay. So we need to follow the chain of command. We need to follow the chain of command of a particular organization. So I'll discuss now regarding the levels of management. So we have the first level managers, we have the middle level managers, and we have the upper level or top managers. Okay, so when we say first level managers, okay, responsible for managing the work of non-managerial personnel and the day-to-day activities of a specific work group or groups. Okay, so it motivates staff to achieve the organization's goals. Okay, so examples of your first level managers, we have your primary care nurse or your staff nurse. We also have your team leader and charge nurse. Okay, so basically these first level managers are responsible to the day-to-day operation of the hospital. Okay, so they perform direct patient care. Okay, we also have middle level managers. Okay, supervise a number of first level managers responsible for the activities in the department they supervise. Okay, liaisons between first and upper level manager. So we have examples: supervisors, nurse managers, and head nurses. So they perform managerial tasks or work. So they manage it. They manage. Okay, they manage the unit or the nursing unit in the hospital. Okay. We also have upper level or top level managers. Okay, organizational executives who are primarily responsible for establishing goals and developing strategic plans. Okay, so nurse executives are registered nurses. Okay, who are responsible for the management of nursing within the organization and the practice of nursing. So examples of your upper level or your top level managers are Vice President for Client Care Services, okay? Vice President for Nursing, Director of Nursing, and Chief Nurse, okay? So these are considered as the top or upper level managers in a healthcare institution or organization, okay? We also have management function. So we have the planning, the organizing, directing, and coordinating. So we have in mnemonics here PODC, or sometimes they call it PODC. Okay, just to memorize it always. Okay, so PODC or PODC. So we have planning. So it is an ongoing process that involves assessing the situation, establishing goals and objectives based on assessment of a situation or future trends, developing a plan of action that identifies priorities, delineates who is responsible, determines deadlines, and describe how the intended outcome is to be achieved and evaluated. So planning simply means the planning phase, okay? Or the planning phase in when you make policies or when you make decision in an organization. That's your planning. We also have your risk management, which is under your planning. So it is an example of planning function. So having in place a system to reduce danger to a client and staff. Okay, so that's your risk management. Okay, you have a plan in case a particular situation happens. Okay, so you have a management plan for that. We also have your organizing. So also an ongoing process of coordinating work. Okay, it involves determining responsibilities, communicating expectations, and establishing the chain of command for authority and communication. So when we say organizing, you are making an organization work. Okay, you have to determine the responsibilities, expectations, and the chain of command and communication. Okay, just to make sure that there is an order, okay, in the plan or in the organization. We also have your directing. Okay, it is the process of getting organization's work accomplished. Okay, so it involves assigning, okay, and communicating expectations about the task to be completed, providing instructions and guidance and ongoing decision making. So simply means that directing, it's about doing the organization's work. Okay, so that's your directing. We also have your coordinating. It is the process of ensuring the plans are carried out and evaluating outcomes. Okay, so measures results or actions against standards or desired outcomes, and then reinforces effective actions or changes ineffective ones. So when we say coordinating, it means we are evaluating the task done, okay, or the decision made. Okay, so if it's effective, we reinforce. Okay, however, if it is ineffective, we have to modify or change. So that's your coordinating. Okay, we also have here principles of management. So we have authority, accountability, and responsibility. Okay, so when we say authority, defined as the legitimate right to direct the work of others. It is integral component of managing. Okay, so that is your authority. It is someone who is authorized to direct workers on what to do. Okay, we also have accountability. It is the ability and willingness to assume ownership for one's action and to accept the consequences of one's behavior. Okay, so we need to be accountable of the task that we performed, okay, or that we accomplished, okay, and to accept whatever the result there is. Okay, so that's your accountability. We also have your responsibility. It is an obligation to perform a task. So responsibility for nursing actions can be transferred to another practitioner, okay, through delegation, but accountability always shared. So whatever the outcome of that delegated task or nursing actions, you have a share on the accountability. Okay, so that's your responsibility. Okay, so skills and competencies of nurse managers. So nurse manager should be a critical thinker, should be a good communicator, should manage resources well, and enhance employee performance, build and manage teams, manage conflicts. Okay, managers also should be a good time manager. Okay, should manage the time. Okay,